Well, traditionally a public health report looked at the patterns of illness and disease in a community and made recommendations, particularly for the health service, about what health services were needed in that community. The way this one is different is that we're saying we have a lot of that knowledge now, we have it in the data, but what we need is the public's own view of what the risks are to them and to their health and the health of their families, but also what their assets are and what more we could do to help them mobilise their assets to improve health and well-being in this borough. I think people have got quite cynical about the way many public services have been run in the past. They've been run by professionals who thought they knew more than the communities they were providing services to. And I think increasingly with a whole range of issues, drugs and alcohol, obesity, we've spent lots of money on it and the problems are getting worse. And I think we need to find new ways of doing it by mobilising the community's own knowledge and experience and assets. And I think that's really what will be the future of public sector delivery, but particularly the future of doing things about public health challenges. Partly that means that we as professionals in a whole host of services have to change the way we work for the community, so that we're not doing things for people, but what we're trying to do is enable the community to do some things itself and to be more vocal about demanding what it wants central government to do for it. And those assets in communities, both to help and to be active politically and socially in changing the environment that creates health or destroys health, those assets need mobilising, and there is a number of things we can do to help that. Blackburn with Darwen is a particularly challenged area. We've got a high percentage of the population amongst some of the least wealthy in the country. And that puts them at particular risk. In particular, it puts them at risk of poor life chances. And that means that their families, their children, are not perhaps going to live as healthy and as long a life as the average person in England. And we think there is a lot we can do about that, but we can't do it just by buying services. What we have to do is do it by enabling and mobilising the community across every sector to undertake prevention work, to make the environment healthy and to help people live as happy and healthy a life as possible.